We see lots of clients with diabetes at Complete. One of the reasons for that is there is quite a strong correlation between certain musculoskeletal conditions, and by that I mean muscle and joint conditions, and diabetes. We particularly see muscle and joint problems in patients who have more uncontrolled diabetes. Now, we know that one of the best things you can do to reduce any chances of getting any muscle or joint problems or any other secondary problems from diabetes is to control your diabetes as best as possible. Now, that often requires a sort of multifactorial approach, such as looking at what you're eating. Certainly it's essential to be carrying out regular exercise, but also taking the medication and liaising with your GP about optimizing your medication to ensure that you control your sugar levels. Now, in clinic, we often see diabetics with shoulder pain. You may have heard of frozen shoulder or adhesive capsulitis, and we know that 2 to 3% of the population get frozen shoulder, but that can rise up to around 20% if you're diabetic. So there is a link between diabetes and frozen shoulder. We also see patients in the clinic with carpal tunnel syndrome, and often we see those patients for a steroid injection to try and control their symptoms. So if you're getting pins and needles, particularly at night, in your hand, then you may be getting carpal tunnel syndrome, and that's where the nerve in the wrist gets affected. And again, unfortunately, that is something that can be related to your diabetes. And the third thing we see at Complete that often is related to diabetes is tendon problems. We see a lot of tendon problems. That can range from a condition called decurvens, which is a tenosynovitis, which is where you get pain in the thumb, but also the Achilles tendon, and also the tendons around the hip and the knee. So often we do see tendon problems if people have diabetes, and it has been shown that there's not only a link between those, but often it does take a little bit longer for diabetic patients to improve because it does take a little bit longer to heal.